Hey everyone, Dr. Shaikh here from The Dentalist. I hope you all are doing great. Today, we're diving deep into one of the most tested and often misunderstood topics in dental materials, synthetic polymers. Whether you're preparing for dental school exams or international licensing, this is going to be your one-stop lecture for everything you need to know about synthetic polymers. Let's break it down step by step with zero confusion. So what are synthetic polymers? Synthetic polymers are long chains of repeating units called monomers. These are created artificially, usually from petroleum-based chemicals. In dentistry, synthetic polymers are used to make denture bases, orthodontic appliances, impression trays, and temporary crowns. Now, depending on their monomer type and how they're linked, polymers can behave very differently. Think of polymers like cooked spaghetti. Some are stiff and straight. Some are sticky and tangled. This behavior depends on their chemical structure, cross-linking, and polymerization process. So as we're talking about polymerization process, there are two main types of polymerization you must know. Addition polymerization, which is also called as chain growth polymerization. This is the most common in dental materials. An example of this would be if we take methylmethacrylate monomer and we let it go through the addition polymerization, it would form polymethylmethacrylate, which is called as PMMA. So in addition polymerization, there is no byproduct released. This process involves initiation, propagation, and termination. In initiation, a free radical starts the chain reaction. In propagation, monomers keep adding. In termination, the chain stops growing when radicals combine. Now let's talk about the second type of polymerization, which is called as condensation polymerization, or another name for it is step growth polymerization. It is less common in dentistry, but still it's important to know. Key features include each step in this process involves the loss of a small molecule like water or alcohol. It typically forms byproducts like water or alcohol. And then in this one, the polymer builds slowly and needs functional groups on both ends. An example of this would be silicones used in some impression materials. A quick tip to remember these two processes would be in addition polymerization, remember that there is no byproduct formed. And in condensation polymerization, the byproducts are released at every step, like water or alcohol. Okay? And an example of condensation polymerization would be silicones impression materials. And an example of addition polymerization would be what? I want you guys to think of an example of addition polymerization and let me know down in the comments below. Alright, now let's talk about the structure of polymers. The behavior of a polymer depends on its structure, as I told you before. The structure could be linear, like straight spaghetti, flexible and soft, or it could be branched, like side chains of the main chain. A branched structure would have a moderate kind of strength. Another type of structure is cross-linked, in which chains are connected like a net, rigid and strong. So cross-linked type of structure in polymers is the most rigid and strong type. So polymethylmethacrylate with cross-linking would have better resistance to wear and heat. Okay? Alright, now let's talk about the glass transition temperature. This is the temperature at which a polymer transitions from rigid to rubbery. I repeat, rigid to rubbery stage. Transition of a polymer would be called as a glass transition temperature. So below glass transition temperature, polymer is brittle, and above glass transition temperature, polymer is flexible. Now, an important glass transition temperature to remember is of polymethylmethacrylate, which is 105 degrees. So at mouth temperature, it remains hard and rigid, as you've seen in the dentures, right? This is vital in choosing materials for prosthodontics or trays that need dimensional stability. Now, an important aspect that you should understand is the polymerization shrinkage. When monomers join to form polymers, they move closer together. This causes shrinkage. Earlier, they're like scattered everywhere, but then when polymerization happens, they become closer. And this shrinkage can lead to poor fit of dentures, gaps in fillings or trays, and dimensional instability overall. Techniques like compression molding and post-curing reduce shrinkage in practice. I hope you understand this concept. Now, let's talk about inhibition and residual monomer. Inhibitors like hydroquinone are added to control the rate of polymerization. They give the material its shelf life. But some monomer may never fully convert, and that becomes residual monomer. High residual monomer can cause allergies, tissue irritation, weakness in the material, and that would cause a lot of problems. So proper curing techniques and heat processing helps us reduce the formation of residual monomer. Now, let's talk about the most interesting part, the clinical applications of these synthetic polymers. So here's where polymers actually show up in real dentistry. In denture-based resin, Polymethylmethacrylate is used. Then in soft liners, there's plasticized polymers for comfort. And then in temporary crowns, there's bisacryl composites. And then orthodontic appliances, we use acrylic plates. And in custom impression trays, we use light cured acrylics. And in provisional restorations, we use resin-based materials, as you know. Each use demands different properties. For example, flexibility, rigidity, polishability, and strength. So I hope by this lecture you got a whole understanding of what polymers are, what they do, where they're used, what is the process, and all that. So let's summarize what we did today. Synthetic polymers are man-made chains of monomers. Addition polymerization has no byproduct. Condensation polymerization is a slow polymerization process and forms byproducts. Shrinkage, cross-linking, and residual monomers all matter clinically. And clinical applications? Almost everywhere, from dentures, fillings, to temporary crowns. I really hope this helped simplify polymers for you. Don't forget to download the free notes that I've linked in the description. And also, of course, like every topic, I've also put the link in the description for a free quiz for this chapter. And if you're loving these chapter-wise breakdowns, like and subscribe for more. Please let me know if you have any questions. Write them down in the comments below and I would love to explain further. Join our dentalist community for exclusive quizzes, lectures, and more support. Until next time, study smart, stay consistent. Take care till we meet again.